New data suggests natural immunity from COVID provided better protection against the Delta variant compared to vaccination alone. That's from a report published by the CDC. It found vaccinated people who had a previous COVID infection were the most protected against Delta. People who had never been infected and were never vaccinated, well, they were the least protected. The study analyzed more than 1 million COVID cases in California and New York. The infections all occurred between May and November of last year, before Omicron started spreading. The data appears to lower the urgency for vaccines, at least amongst those who have had COVID. But one of the authors of the study emphasizes vaccines are still the safest way to protect against the disease. CNBC's Meg Tirrell now. Meg, the study analyzed Delta. Do we apply it to Omicron, too?
I don't think so, Kelly. This is a pretty specific look at a snapshot in time when the Delta variant took over. The study authors note that Delta became predominant at the same time immunity from the vaccines against mild disease was starting to wane. And this doesn't take into account the impact of getting boosted or what the situation will be for Omicron. Of course, that variant is now estimated to make up 99.5% of new cases in the U.S. And we know that protection from both prior infection and vaccination against it is decreased. The CDC says it should have updated data on the vaccines and boosters against Omicron this week. Kelly?
Well, some new models are suggesting that Omicron could be the last phase of the pandemic. Meg, what do we know?
Yeah, so there are differing views on this, but a hopeful new piece in The Lancet suggests, quote, after the Omicron wave, COVID-19 will return, but the pandemic will not. This was written by Dr. Christopher Murray, director of the Institute for Health Metrics and Evaluation, a widely cited modeler during the pandemic. He says by March, the Omicron wave will have passed through most of the world, leading to a period of low transmission. After that, he says new variants will emerge and some could be more severe than Omicron, and immunity will wane. So countries should expect increased potential transmission in the winter. But he says because of broad previous exposure to the virus, regularly adapted vaccines and antiviral drugs, the health impact of COVID will be less, more similar perhaps to a severe flu season. So how close are we to getting through Omicron here in the United States? We're already seeing cases come down in cities in the Northeast, and early clues can be found in wastewater tracking across the country. Viral levels are dramatically lower in places like Boston and tipping over a peak in San Diego. Of course, whether we see the precipitous case declines like we see in South Africa is still an open question.